to work directly with the summer program coordinators during their time in the Dominican Republic. And I don't know, Jill, if you want to introduce yourself now or later.
I will introduce myself. So my name is Jill Nagy. I work with our ILAC programs here on the Omaha side. So while Margarita does all the really hard work in the Dominican Republic, I have the much easier job of working with everyone through preparation and formation and everything that happens here in Omaha. So I'm excited to share with you a little bit more about this really unique leadership role with our flagship program in the Dominican Republic.
Okay, so I'm going to share the presentation so you can follow along. And actually, we need to start recording too. Let me get that.
I already did. We are recording.
I think I went too far by clicking on recording. But just wanted to address that ILAC stands for Institute for Latin American Concern. And it's an office within Creighton's Global Engagement Division that partners with a center here in the Dominican Republic, with which we've had a relationship for over 45 years. And today we're gonna talk a little bit about who our team is. So Jill and I are 2 out of 4 people in our team right now, a little bit more about the history and the mission of both ILAC and SESI, which is the Dominican counterpart, the background of this summer program, our flagship program, what a daily life looks like in both the city while people are at the center, as well as in the rural communities, expectations and logistics for coordinators, and the application process. So this is our team. Jill and I already have introduced ourselves, and we have Katie Kaufman and Jenna Briner, who are program coordinators in Omaha and the Dominican Republic, respectively. And together, we help put the programs together from Omaha all the way to the DR and back. And in case you don't know, the ILAC Center is located in the city of Santiago, right here in the northern side of the Dominican Republic. And this is where the Dominican Republic is in relation to the world map. We are an island in the Caribbean that is shared with the country of Haiti, as you can see here. And Santo Domingo is the capital of the country. And our office, as I said, has had a presence here in the Dominican Republic for over 45 years. We annually have about 500 volunteers, anywhere from high school students to surgeons who travel to the Dominican Republic for a variety of different programs. And we're hosted here by a Dominican nonprofit that, although is known colloquially as ILAC Mission or Misión ILAC, actually has a Dominican and Spanish name. SESI, Centro de Educación para la Salud Integral. And in the bottom, you see a picture of the 4-acre campus that we call the home away from home for those Creighton folks that visit us every year. So our partner, Misión ILAC, or SESI, is a Dominican NGO, like I said, that has an international Catholic and Ignatian-inspired philosophy. And they're about fostering healthcare and education to foster the well-being of people in the rural communities of the Dominican Republic, as well as the growth of all the participants that come from different walks of life in different countries. And it's based in the city of Santiago. Like I said, these are some other snapshots of the campus, both the chapel and some of the backyard. And it has 4 pillars that it works on. The biggest one is healthcare for sure, and this program is a big part of that. Agriculture, education, and spirituality. So let's talk about the summer program coordinator role and just the basics of the program as a whole. So summer program coordinators get here a little before the participants do and leave after they do. So the dates are slightly over a month for this 2021. It'll be June 28th until July 30th. And they get to participate in everything that the students do, which is a 2-week immersion into the rural communities where the clinics are set up, a 1-week orientation in the city of Santiago, but the coordinators get an extra week of orientation that has components of both the city as well as the rural communities prior to the participants' arrival. So you would have a few days in the city with us, and then you'll have a long weekend with your host community to learn more about that community before the group gets here, and also to start setting up some of the logistics that are necessary. Each participant will live with a Dominican host family, and we have at least 2 people usually per family. And what the program is all about is having a multidisciplinary medical team setting up this rural makeshift clinics, usually in schools or community centers. And we have undergraduates, we have nursing, pharmacy, dental, and medical students, as well as professionals in all those areas that staff those clinics. A bulk of the time is spent on those clinics, but also it's very important, and we foster a lot spending time with the host families and the community as a whole outside of the clinics and forming those relationships. And there's a big component of reflection to the program as well, both formally in group settings, as well as informally through journaling or just whatever other means of processing individuals prefer to use. And I already talked about the composition of the teams. So we tend to have about 5 teams every summer with 2 to 3 people in each of the categories that I mentioned, student-wise, and then professionals in all those areas. And those teams are led by 2 co-coordinators. And the co-coordinators usually can fall into any of the categories. So it could be an undergraduate student, a nursing, a pharmacy, a dental, or a medical student, as well as we've had recent graduates participate, or grad students, Jordan, like your case. And the program begins with a series of preparation meetings in Omaha this year virtually, like this meeting, that take place for both the group as a whole, but also a series of preparation meetings that will take place only for the coordinators to get ready prior to traveling to the Dominican Republic. And this is what the sample calendar looks like for the 32 days or so that you would be in the country. So coordinators would arrive on a Monday, spend an entire week here in the orientation piece for coordinators. Then the following Tuesday, the participants would arrive. We'll have those 3 full days of orientation in Santiago. Then where it says Campo is where you go into the rural communities for the clinic work and the immersion piece. And on the last Sunday, they would come back to the city to do some packing and kind of closing up of the program. We'll have a day for R&R at a beach, and then a final closing day with a mass and reflection and the opportunity to host some community members at the ILAC Center to say goodbye to them. And then the next day, the participants will leave. Coordinators will get to do a few other closing activities, both R&R, reflection, and also paperwork wrap up, and then coordinators can leave on that Friday. And this is what a typical day of orientation looks like while we are in the city. So those couple of days after the participants arrive. This is not for the coordinators only, this is for the whole group. We'll usually offer a quick reflection at 7:45, followed by breakfast. Then in the morning, we're going to have a series of different activities within the center. It could be sorting and packing supplies by profession. It could be a talk. It could be actually kind of Spanish scenarios. For Kayla, you may not know this, we're switching a few things around, but the essence of what you did is still preserved. So you're finding out some new things that we're doing starting in 2021. Then we'll have lunch at the ILAC Center at 12:30, and in the afternoon, groups will be deployed to different parts of the country, actually, not even only the city, to the different educational tours and activities that hopefully will complement the experience that you'll have in the rural communities to better understand the healthcare system here, to better understand Dominican culture and kind of daily life in the Dominican Republic, and to do some R&R as well. You'll be back to the ILAC Center for 6 o'clock dinner, and in the evening there'll be either some lectures or dance lessons or some educational talks, oftentimes actually led by the coordinators. So that's a prime time when the coordinators have a role. You may find Kayla right here loading boxes into a truck. And then for the 2+ weeks that groups are in the rural communities, breakfast will be a little earlier, so about 7 o'clock, so that they can start with clinic. And because we have condensed the program a little bit, clinic will now run until about 3 o'clock with a snack in between, and then a full late lunch. And then following lunch, there'll be time to spend with the community, whether in the form of home visits or community-wide activities or talks that the group organizes for the community. It could be a baseball game, it could be cooking lessons, whatever it may be, but just time spent with the community before having supper all together and then getting to go home after supper. And a couple times in the week, coordinators will facilitate a reflection for the group. So it will follow dinner and before people get to go home. And actually, this is from Kayla's clinic 2 summers ago. And we'll have some closing activities upon return to the city following the full 2 weeks in the rural community. Like I said, a relaxation day at the beach. We'll have to resort and repack and inventory the supplies that were left over to put them together for the following summer. You'll be bringing back forms of the patients that you saw, and those need to be organized. And like I said, a closing mass and a meal with community members that you get to invite, and some closing reflection opportunities. And what we're looking for in coordinators is definitely Spanish proficiency. That's the most important skill because you are the leaders for the rest of your team that has approximately 15 people total between the students and the professionals. And you're the liaison between them and the community members. So it's very important that you feel comfortable enough with Spanish to be able to facilitate that exchange and sort of to be the person that can handle and troubleshoot any logistics and any emergencies that may arise that require a strong command of Spanish. We give strong preference to people that have experience in the Dominican Republic or in another international experience, just because you already have a background in what life is like, more or less. We are looking for people that understand and buy into the ILAC mission and the objectives, that truly believe in the idea not only of doing the service, but being immersed and being about building those relationships with the community and the group, and also fostering the reflection that needs to happen for that experience to be full circle. We want somebody who's comfortable in having a leadership role and willing to role model all the rules and the guidelines that we expect of everybody. We need somebody that is very quick and flexible. When Kayla talks, and I know she's nodding right now, I was also a coordinator, so I know what it's like to be in those shoes. And there's a lot of hats that a coordinator wears at all times, and also a lot of things that could be coming your way. So it's important that it's somebody that can keep an even keel and not get too flustered with some of the stressful environments that you'll be put in as you're handling people that may be younger than you, people that are older than you, that could be your parents or even grandparents, sometimes the professionals, handling the American group's expectations with the community expectations and so forth. And we also prefer people that have experience leading reflections before, since that's one of the other big responsibilities that the coordinators are going to have for their whole group. And I'm going to turn it over to Jill now.
All right, thanks, Margarita. And I just want to say, you know, this is a really special program, and if you're interested in being a leader of teams in this program, it means you're looking for a little something extra, perhaps, and those is why I'm so excited to work with the coordinators, because we really do get you know, we get to know you on a deeper level, because we do a lot of preparation as well. And I see that one of our participants has to jump out. That's fine. We're recording this whole thing. We'll send it to you. So the summer coordinator responsibilities, there are some things that we ask of you before the actual program and dates in the Dominican Republic. We do some orientations with our group, because we do have 2 leaders per compo. So we have, you know, co-coordinators in every compo. You may or may not know each other ahead of time, and you need to get to know each other very well and trust and rely on each other before you get to the Dominican Republic. So we do a lot of group orientations. We do, you know, we do team building, just things to really get to know your people and get to trust the other person that is leading this group with you. So we have about 5 meetings throughout the spring semester, and we do In the past, we've done an overnight retreat. I don't know if it's going to be overnight this year or if it'll be something just maybe one day perhaps, but we do require a time commitment of that as well, not only coming to the meetings, but of those larger group meetings and the overnight retreat also. And then like Margarita mentioned on that calendar, there's a week-long orientation just for coordinators in the Dominican Republic before the rest of the group arrives. So you really get to learn not only, you know, the ins and outs of the summer program, but your role and what you will be leading. If you've done Encuentro before, I like to say that, you know, you will be the Margarita or the Kat or the Jenna of your group. You will be that person who solves the problems, who somehow has the answer, even if you're furiously paddling underneath to try to, you know, keep an even keel on the top and figure out how to solve the problem. You will be that person to your group. So, you know, being able to, like Margarita said, kind of keep cool under pressure is something that is definitely a bonus in this position. And then during the summer program, you will be asked to lead some of the orientation activities for our participants, because there will be some different you know, cultural immersions and like Margarita mentioned, maybe some dance lessons and things like that. And those are led by our coordinators for the rest of the students. And that also helps you get to know your group a little bit. It gets, you know, they get familiar with you as kind of the coordinators of this leadership role of their team. So it's a way to get to know your team a little bit more in country as well. And you will really be the main point of contact with the rural health promoters to run and manage that clinic every day. You will help with finding housing. The compos that we have selected for the summer program have housing pre-selected to a certain extent. We know there are enough homes for our people to stay in, but that weekend before, when you go to compo with your co-coordinator, is when you'll meet all the people, meet all, you know, and really solidify all of those housing arrangements for your whole team. And again, that all happens before the rest of the students get there. You will be the person who has to enforce the rules. You know there are rules. Everyone's participated in the ILAC program before. You know there are rules in the Dominican Republic. You will be the person to have to enforce those to your peers, your colleagues, maybe some people older than you. You will need to make sure that there's proper documentation for all of the clinics. And like Margarita said, facilitate those group reflections, because especially for someone who hasn't had an experience like this or something similar, this can be exciting and overwhelming and terrifying at the same time. So really facilitating those reflections and making a safe space for people to share their thoughts and kind of unpack at the end of the day is a big component of this role. And really be a resource for support for their participants. There will be times when it's tough. The novelty of not having a flushing toilet and not having a shower wears off after about a week, and then you're still there and you need to keep the morale up. So it really is kind of that cheerleader mentality as well. Even if you're having a tough day or there's been a really difficult patient and a really hard thing to see, really keeping up that morale and being a resource for support for your team is a huge part of it while you're there. And then after the summer program, everybody goes away. There's still work to be done. So like Margarita said, we need to repack the clinic supplies to see an inventory to see what we have for next summer and what we have to send down, and do a lot of the data keeping and record keeping for the program. And then we always like to do some sort of reunion or get together when everybody's back. And that's something that we ask our coordinators to plan as well. There are benefits. We're asking you to do a lot. There are benefits to this as well. So we provide your travel insurance for the time that you're in the Dominican Republic. There is, you don't have to pay a $50 deposit. We pay your airfare to and from the Dominican Republic. We pay all your room and board, your excursions, and your tours. And you do get a $400 stipend for leading the program. So not only do you not have to fundraise to participate, your costs are covered and you do get a little bit of a stipend. So we know that we're asking a lot of our leadership team, and we do hope that these benefits kind of help balance out some of those things that we're asking you. And then we do reimburse you for the exit and baggage fees, the customs exit fee and your baggage fees for one bag to and from the Dominican Republic. And I sound like a broken record here, but we do ask a lot of you as our leadership team to uphold not only the code of conduct, but also enforce that among your peers, your team members while you're there. Really understand, support the model of Creighton, the mission of Creighton, and the mission of ILAC SESI as well. Of course, no illicit or illegal drug possession or use when you're in the compo. That goes for you and your team members. No alcohol, as you know, in the ILAC Center or in compos, never any drunkenness, and no intimate relationships within ILAC participants, volunteers, or Dominicans during that time. So these are all things that we ask that our coordinators uphold, but also that you will be responsible for enforcing within your team. And applications are open now. So the summer program, Margarita gave you the dates earlier. It's about the month of July with a couple of days tagged on for our coordinators. Applications are open now and they close on October 15th, and then we'll do an interview process after that. So you can get to them through our general study abroad portal. You can apply for, there's an application for summer program and an application for summer program coordinator. So if you want to apply for the coordinator role, you just open an application for summer program coordinator, and that lets us know that you're interested in applying for this leadership role. And again, those are due October 15th, and we'll have interviews via Zoom, either the end part of October or the beginning of November. And we'll let everybody know, offers will go out before Thanksgiving. That's our timeline. So with that, I want to turn it over to Kayla, who is really who we all came to hear talk. Tell us a little bit about maybe why you decided to apply and participate as a coordinator as opposed to, you know, in a participant role, and just tell us a little bit about what that experience was like for you.
Yeah, absolutely. So, as Jill said, my name is Kayla. Oh, sorry, I have some bracelets on that are very noisy. But my name is Kayla. I graduated from Creighton in 2019. So it'll be 2 years in May, which is crazy. But I did the summer program right after I graduated. So June and July of 2019. And I absolutely loved it. In terms of why I decided to apply to be a coordinator specifically, I had had some previous experience with ILAC. Most notably, I had done the semester in the Dominican Republic with Encuentro, and just absolutely loved it. It was a really pivotal moment in my college experience for me and kind of just in my life in general. And when I came back to the US and kind of was going out throughout the rest of my college experience, I just felt like that chapter kind of hadn't closed for me completely yet. I felt like there was more to explore there, and I wanted to go back, and I wanted to work with ILAC in more of a leadership capacity and kind of be on the other side and help facilitate an experience like I had had when I was in the study abroad program. And I think more than that too, I wanted to be a part of ILAC's programs in actually providing some of those services for the Dominicans and learning how to really work with them on that and work with the community and kind of be a community liaison. So that's what really drew me back to apply. And then in terms of my experience there, again, like I felt like I was just nodding the whole time, like the whole presentation, because definitely everything they were saying was, that Marguerite and Jill were saying, was super relevant in terms of, it was such a great experience leadership wise, in terms of just learning a lot more about yourself. I feel like I got so much more confident from the experience because you really do have to be super flexible on your feet. People in your group really do look up to you, and that's a really humbling thing. But it also really, for me, it pushed me a lot as a leader, because there was moments when, you know, you have a crazy clinic day and you're kind of doing stuff all day in clinic, and then you have to turn around and someone maybe needs help processing something because they've never had an experience with this sort of, you know, poverty before, or, you know, they're freaked out because they've never taken a bucket shower before, you know, just like different things like that. And so you have to really snap into different modes all the time, kind of to be what your group needs you to be, which I thought was super awesome. It was such a great challenge, such a great way to get to know other people. And the other thing I really loved about my experience was probably the main thing my favorite part about it was the connections I formed with my summer program community. I definitely would say I loved the compo I was in for my Encuentro semester. Like, actually my host mom messaged me on Facebook the other day and was like, how are you? And, you know, like stuff like that, like definitely still keep in contact. But my summer program compo was I just felt like I knew them on a much more intimate level because they trusted me to speak up in conversations, and they, let me into their community and trusted us to hear kind of their story and hear what they wanted and stuff like that. And I absolutely loved working with our community and our coordinadora. So that was probably my favorite part of my experience, not only getting to be there for my group and getting to know my co-coordinator, Stephanie, shout out to Stephanie, she was the best, but, and kind of like getting to know the group and facilitate that experience, but also getting to know that specific Dominican community so well, and just really, truly work with them. I mean, to me, that was just awesome. So that was kind of my experience. Something else I also really always like to know about my experience too is that I double majored in journalism and Spanish. Like I didn't know anything medical related at all before I went down. Like literally nothing. They would say words to me and I was like, let's break that down a little. Like I'm gonna need some explanation. And that's not to say that like, don't do your research or anything like that. I'm not saying that, but I think too, it's just really important to note that if you don't know a lot about science or medicine or dentistry or any of that, it can definitely be learned. You can pick it up you can kind of pick it up when you're there with them. And the professionals usually are very willing to sit down and explain things to you. Or if you sit down with them ahead of time and kind of say, okay, when I'm, translating and interpreting with you, how do you want to do it? Or like, how do you work with patients? And so for me, even though, again, I'm not medical and I never want to be doing any of that in my future, it was super eye-opening. And I absolutely loved getting a chance to work in that field and kind of bring my own spin to it and bring my own, I don't know, I guess just my own talents into that. Like there was definitely room for me to still kind of have a job and have a role and bring something unique into that. So yeah, that's kind of my experience, but I don't know if there's anything else you wanted me to hit on, Jill, but again, I absolutely love summer program and would definitely recommend it. So I'm happy you guys are here.
Any questions for Kayla? What was one of your most heartwarming, fulfilling moments? And what was one of your more challenging moments?
Ooh, I think I'll start with the challenging one. Honestly, well, I can think of I can think of a couple things, but I think more so the one I'll mention is one that I think maybe a lot of coordinators can relate to. Is just sometimes you have patients come into clinic that sometimes you have patients come to clinic and the services that you provide are just not what they need. Like they need something more than that, or it's kind of a medical issue that you're not really going to be able to address in the time that you're there. And I think that for my group in general, and just talking to other coordinators that I served with, was I think a really challenging thing for all of us, because you definitely want to, I don't know, you want to be helpful in those situations, and you want to be able to give some hope and stuff like that. But sometimes that's just outside your scope of practice, and you have to really, and I mean, again, like I said, I'm not medical, but I think seeing those professionals in those situations, a lot of times, whether I was translating it or kind of just watching it, had to tell me like, that's outside our scope. We can't really ethically do that. That could be really challenging. I think that for me was always really heartbreaking. And I can think of a couple like really vivid examples where you kind of just walked away and it just hit you really hard. In terms of the most heartwarming, again, so many to think of, but we really loved our compo community. The last night we were there, we did like a little feast thing, and we made a bunch of food and kind of had all of the host parents and everyone from the community down, and just had like a big party essentially, and got the music going, and we showed them how to make s'mores, stuff like that. And it was just a really cool culmination to our experience, and seeing so many host parents come up and seeing the people in my group interact with their host parents, for the last night, and having our coordinadora there and our host mom there and like our cook and everyone was just, it was a really cool culmination. And there's just moments where me and my co-coordinator were just kind of sitting, like we were just like sitting there kind of trying to take it all in, and just remembering those relationships we built with the community. So that for me was a really heartwarming moment, was just getting to share that with them, for sure.
I have another question.
Go for it.
What was reflection time like for your group? You know, some people are really into it and love it. Some people that's not their thing, not necessarily their comfort zone. How do you balance that with your group?
Yeah, I think for us, something that Steph and I did that I think in the long run was really good is that we were really open about everything with our group. So if there's something going on, we always really like addressed it. We set really good ground rules, and whether that be for reflection or whether that be for having those discussions. In terms of reflection specifically, we acknowledged at the beginning, even when we were starting reflections at ILAC before we even got to Compo, you know, hey, we realize that this isn't going to be the way some of you process things super well. So we want you to know that we're available outside of these times. And we want you to know that we respect if you're not sharing a lot in these reflections, or like you just need your time to journal or whatever. I mean, obviously we also encourage them to kind of push themselves with that. But I think that just from the get-go, we did a solid job of saying, you know, we acknowledge that different people are going to do things differently, but also setting those ground rules. Physically, when you're in Compo, the way we kind of facilitated it / created our reflection spaces, if you will, is we had a very specific place in the Compo where we did our reflections that was kind of away from everyone, so we could kind of just have the group more just on our own. And then with that too, at the beginning of every reflection, Stephanie would always do like a headspace meditation kind of thing, just to kind of get everyone into a more kind of like calm, we call it like zened out headspace if things have been crazy or whatever that day. And then from there, we just left it really open. And again, we encouraged people to share as much as they could. So sometimes in reflections, we would say, okay, hey, you know, here's like a starter question, and we would like everyone to share if we're comfortable. So a lot of times we would start it out that way and then kind of get deeper. But we did have, I think because we were really open about it and because we encouraged people to do it their way, we did have people that sought us out to do more one-on-one reflections, which is cool. We would notice some people that just journaled a lot more. But by the end, our reflections were pretty, I mean, we would talk a lot, like people were pretty comfortable. But I think in terms of your question, Jill, about the balance, just acknowledging that people are going to do it different and really encouraging that is how we did it.
Anyone else have questions for Kayla? I mean, I could ask you questions all day, but that's, I mean, not really why I'm here.
I have a quick question. So for reflections, did you make your own questions then, or are you like sent with questions to like go over?
I'm trying to, I think that y'all gave us like a guide of some sort, like here's some things you can hit on with them. So ILAC gave it, yeah, I think that's what it was. So ILAC gave us kind of like a guide, and I believe the participants all had their own reflection guide that they could utilize throughout the week. But for the most part, Stephanie and I kind of would sit down usually a day or two before the reflection period, and we would talk about, okay, where do we feel like the group's at right now, and kind of like take the temperature of the group, if you will, and then kind of decide how to structure our reflection from there. So for example, throughout the week, if we noticed that a lot of people were really, I'm trying to think of some of the stuff we did, like if a lot of people were really thinking heavily about social justice within the country or different like injustices or something like that, we would structure the reflection more that way that week. If a lot of people were really stressed out that week and we felt like they just needed time to talk, or people were starting to have really meaningful connections with their host families, we would structure it that way. So we did have some resources provided, but it was also nice because we were kind of able to take it our own direction if we wanted, and kind of really go with what was most beneficial for the group. Does that answer your question? Okay, cool.
And one of the times that all of our coordinators to get together, one of the meetings with just the coordinators ahead of time, is all based on reflection. So we talk about how to lead reflections. We do provide a very useful resource manual. Obviously, Kayla remembered every detail of that. But that's just a backup, you know, as if if you stall out and you're like, gosh, I do not know what to do with the group today, you've got a resource manual of a whole bunch of things you can pull out. But the best thing is exactly what Kayla and Stephanie did, is to kind of read their group and adjust. But we do a whole session just based on that, because it's one thing to be comfortable participating in reflections. It's another thing to be comfortable leading them. And we recognize that. So that's why we do a whole preparation meeting just on that ahead of time.
And I will add that every group has a different dynamic. So there are groups that, for example, have rotated and other people in the group have volunteered to lead the reflection too, or given suggestions. So a lot depends on who's on your group too, and just reading the vibe of the group.
What other questions? We've got a couple minutes left here. Or final words of wisdom, Kayla?
Oh, I think the one thing I forgot to mention is I also loved, I can't believe I forgot to mention this, but the relationships that I formed with the other coordinators was awesome too. Like my coordinator group was good content. Like that's another really cool part of the job and of the leadership experience, is when we all got to be back together and you know, kind of compare notes, like, oh, how did you handle this in your compo? Or like when this situation came up, so that to me was super cool too. And I felt really lucky because I was one of like 2 or 3 either recently graduated or not medical school coordinators in my specific group. And so that was such an incredible opportunity. Like I got to learn so much from all of the M1s and the M4s, and get to know them and just learn from their life experience. So that would be something I forgot to mention earlier. I loved that portion of it too.
I echo a lot of what you said. And actually, whenever I talk about the summer program, I always say I've done it twice. I was in business, definitely no background in medicine, but I feel like I learned a lot. I still know how to take blood pressures because of that. And also affirm that I do not want to go into medicine. So, you know, definitely all of that. Courtney, since it's just you left, just if you want to openly ask the question you had about being a nursing student and a coordinator, just so that you get an official answer.
Oh, yeah. I don't really remember how I phrased it, but what is kind of like, well, I guess you didn't go as a nursing student, but maybe Jill or Margarita know more, but like, what is it like being a nursing student at the same time as being a coordinator?
Kayla did see her peer as a medical student and a coordinator, which is more of a norm, but Courtney wanted to make sure she could do both, that she could still be, you know, an N3 nursing student and then be a coordinator. And I said that, yeah, that oftentimes, like Kayla said, coordinators are double dipping in the roles. I mean, I can just tell you what I know, and then maybe Kayla can say what she saw Stephanie do, but it requires a little bit more of that multi-hat format, because you'll be doing your role as a nurse in the clinic, but they might pull you away for a coordinator specific thing. We try to partner people in ways that they can support each other. So, you know, Kayla had a medical person with her, but we don't always have people like Kayla who don't have another role in the clinic other than being a translator. So sometimes both are doing it for credit too. And then it just requires, you know, knowing how to balance both roles as needed.
I would say something else too, again, that I think Stephanie and I did, like retrospectively, I think we did well, is Stephanie and I like very openly communicated about that fact a lot. Because she was very much like, I wish you could meet her. She's great, but she's very like energetic, hands-on. Like she very much wanted to be doing medical stuff in the clinic. And she openly expressed that to me a lot. Like, I want to be in and I want to be seeing X amount of patients today. And so we would kind of talk through that, because then a lot of times too, we would have to shift things, but that shift meant that I was maybe taking over more of running of the clinic that day. And it was like, that was totally fine for me and it worked out really well. But I think, yeah, kind of going off what Margarita said, if you are in that position with someone, just kind of having that conversation about, okay, how is this going to look and what are both of our expectations for it? Because then there was some days when she was like, okay, hey, you know, I know we know that it's overall going to be a crazy day for the clinic, so I can't be seeing as many patients today. And so we would go from there. But then, you know, a couple days a week, we were able to work it to where she was able to kind of just be more of do the medical stuff. And then I was able to kind of do all the other stuff to keep it functioning. And then, you know, sometimes if that happened too, maybe in the afternoon, she would do the house visits or like pick up some other area to kind of balance things out a little bit. But we would just talk about it day by day usually.
Can I share something really quickly? I know we're right at the end of our time, but since we're talking about this, hold on, we have a video from Stephanie, but hold on, I have to make sure I have my sound on. Okay, because she shared about being a medical student and a coordinator that we just used in the last meeting.
Hola familia, me llamo Estefanía, mucho gusto conocerles a todos. My name is Stephanie, I'm a third year medical student and I went to the summer program between my M1 and M2 year. I was also a coordinator, which you can be a coordinator or a participant. And I was asked to speak to you guys about why you should do it as medical students, and short answer is do it. And the long answer is I truly felt like this program was tailored for me, both as a medical student, but also as someone who, you know, wanted to take advantage of being immersed in a language. You know, I did come with a little bit of a Spanish background before I went. You don't need Spanish, but you'll absolutely leave with some, good or bad. And then, you know, what you'll get out of this program is, you know, sure, you'll get the superficial medical stuff. You'll learn new, you know, like prescriptions, and you'll learn how to do a physical exam. Your residents will teach you a lot. You'll learn, you know, what a medical interview would be conducted in Spanish. You'll know how to run a clinic effectively. You know, whether you're a coordinator or participant, you can practice your blood pressure cuff, you know, inflating, and there's a lot of things like that that like are fun for a medical student. But I think where this is different from, you know, volunteering at your local hospital is that you're getting the benefit of also doing this in the context of another culture and really being immersed in, by examining their healthcare system, you're more able to understand our own. And as a future physician, as a potential advocate, this is so important because sometimes you can't really look yourself in the mirror without, you know, maybe someone telling you like, this is what it's really like, and it's not like this everywhere else. And having that understanding is so crucial. And secondly, you know, as much as we provide this, you know, essentially primary care clinic and dental care and things that really can change someone's life in the long term or in the short term, what really happens is that you pull away from it and are completely changed by what they give you. They give you a sense of community. They give you a sense of, you know, commitment to raising a child and, you know, what it means to really sacrifice yourself and everything you have in order to see the wellness of people around you thrive, and all of these things that you just wouldn't get, you know, doing a clinic here. And at the end of the day, this is the best thing that's happened to me at Creighton. ILAC does such a wonderful job of being, you know, sustainable. It's not just like a quick volunteerism in and out. You really feel like you're part of a bigger picture that goes year round. And so that was really important to me on a mission basis. So if you guys have any other specific questions, the coordinators of this presentation know me well, so please reach out to me. I have a lot of things I'd love to say, but keeping it short. So good luck, guys. Good luck with your studies, and I hope you choose the ILAC Summer Program. Thanks.
Just had to share. All right. Any final notes for those who are with us or those who might be watching this video later? I know there are several people that were unable to attend. So any final words of wisdom, Margarita or Kayla, to share?
I just would like to emphasize that this is a wonderful leadership opportunity. and hopefully one that you want to take advantage of. We ask a lot, but I think the rewards are also great, like Kayla said.
Absolutely. So with that, I will just remind people that you can always email us questions at ilac@creighton.edu. And the applications again are open now for summer program 2020, and we'll be closing October 15th. So thank you everybody for joining tonight, and for everybody who's watching and tuning in on their own time. And we hope to see you soon and welcome you in the Dominican Republic.